In-person therapy, prescription pills, even shock therapy. People with anxiety and depression have had pretty much the same treatment options for decades.
Now there is a new treatment option in the triad, a legal version of the street drug called ketamine, also known as Special K.
Several patients told 2 Wants to Know's Ben Briscoe it saved their lives.
To say depression and anxiety makes the world overcast is an understatement.
I was suffering immensely. It felt as though there was nothing else that could help me.
Years and years of attempted therapy, medications, and I'll even go as far as saying, using alcohol.
There was an attempted suicide. I was inpatient for a while.
That's why Nicholas, Bill, and Caitlin all turned to a new treatment using a legal form of the street drug ketamine, also known as Special K, horse tranquilizer, or cat Valium.
If I hadn't found ketamine, I absolutely would not be here today. I can say that confidently.
So are you saying you think ketamine saved your life?
Yeah, absolutely.
Just put a lot of things in perspective and made me realize the things that I typically worry about and stress out about are fixable.
I just had a psychological evaluation a week ago, and I'm no longer qualified as clinically depressed.
Congratulations, that's awesome.
Thank you. It's been about 15 years I've had that diagnosis, and I didn't think there was another side to it. So it's been pretty incredible.
In recent years, a growing pile of research has shown ketamine robustly reduces depressive symptoms, especially in patients more resistant to prior medications. Dr. Dennis Carney at Mount Sinai in New York was one of the first to study ketamine therapy.
The case can be made that the available drugs have been available since 1960. There hasn't been a novel mechanism for the treatment of depression until ketamine.
He says traditional antidepressants work on neurotransmitters such as serotonin and norepinephrine. They help nerves in the brain communicate. Ketamine targets a different one called glutamate. It works faster than drugs like Prozac, Cymbalta, or Zoloft. And it's now available in the triad. In this ordinary-looking building, locked up in a safe, is the legal, FDA-approved version of ketamine, used by Restoring Wellness Solutions in Winston-Salem.
I'm a nurse anesthetist by training, so I have a master's degree in anesthesia and have practiced here in Winston-Salem since 2015.
Anna Plummer-Roberts opened up the clinic in February after hearing stories of success among depression and anxiety patients.
Ketamine works well for treatment-resistant patients. So these are patients that have not had good results with trying other medications, and ketamine for some of those patients can be life-changing. Gets them back to finding joy in their life, relating to their family, being functional at work.
Treatments consist of an IV drip over a 2-hour appointment. You're hooked up to heart monitors to make sure your vitals are stable. It's recommended you listen to music without words and cover your eyes.
What we're looking for is to get an alteration in their perception. They feel like their body may get larger or smaller, or art on the wall may kind of change shape. They will have a change in their senses while they're here. That really shows the point in which ketamine is getting to the brain and working on the glutamate system.
The clinic says 6 infusions over 2 to 3 weeks produce the best results. And
ketamine is pretty poorly covered by insurance across the board for mental health.
At $450 per infusion, that's $2,700 for the initial doses. You might need a maintenance dose every 1 to 2 months after that. Money, some say, is well spent.
It's not voodoo. It's not snake oil. The way a physician explained it to me is that your brain's kind of like a ski slope. And we have these treads that we've gone down for years and years, and they're really developed in there. And ketamine kind of acts as a fresh sheet of snow. And it allows you to rework those pathways, so that negative self-talk, that trauma that you carry, you really get a clean slate, and you have the ability to change those thought patterns and those behaviors.
It's been a dramatic improvement. I went back to school after a 4-year absence. I since then have moved out with my fiance. We got engaged. We have just been living a completely different life together.
I would say go into it with an open mind. It's not as, scary as one would think.
I searched and searched for any researchers who had doubts about ketamine treating depression and anxiety. There wasn't much, but everyone I talked with said it should only be used as a last resort after you try all the traditional treatments. Also, never try to self-dose with drugs you buy illegally. That can lead to some serious side effects.